Hi, I'm Ron Albert, and I'm here to speak about the organizational growth as it applies to dentistry. And I'm with the Schuster Center. I'm a mentor, and intellectual property in the slide belongs to George Land and Dr. Michael Schuster, who has given presentations here at the center. George Land explains in his book, Grow or Die, basically that you go through phases of growth, all organizations. And in the first step is experimental, where different factions within the organization are trying to find a way to create something, anything. It could be widgets, it could be M&Ms, something. And at that time, innovative and exploratory and experimental type people are used to develop concepts and ideas and processes in order to make progress within the organization. Phase two, they fine-tune it. And instead of experimental, it no longer is experimental people involved. It has to do with they're trying to duplicate successful processes to reach their goals. So if you're making M&Ms and you figure out what size, you don't need to experiment on the size anymore, or the type of the coating, and so forth. And then after you've done that for a period, you sort of reach a stage of maturity where there's a levelness, there's a happiness, everyone's partnering out, and you're kind of at the top of your game. However, what happens is that you can see it starts to phase out and tail off because your success just isn't growing anymore. And then an additional phase, or the renewal, essentially going through phase one again. And so in order for successful companies to last for a long time, they reach a peak of success, and they can't just coast, because if they coast, they fall apart. So rather, they reorganize, go through another experimental phase, and improve on items. Okay, so what does that mean? Well, in society, we've gone through several different changes lately. Here it is, year 2011. Many people don't use a checkbook anymore. They use their ATM cards, and money is withdrawn automatically. Roadmaps, we're using our phones and iPads to get an electronic map where we are, and we're using GPS systems. So to go and stop at a gas station, get a road map, many people aren't doing that. And many of our young people don't know what dental film is anymore. Not dental film, but film on cameras. What's a typewriter? Hotel keys. You can get those when you travel sometimes in outdated hotels. We're using electronic cards. And many people are using phones that are in our pocket rather than ones that are attached to the wall. And of course that changes when we're in business. Now, dentally, what happens is in the recent years, we've gone through high-speed drills, light cure composites, where we mix two materials together. Many of our newer dentists may not even know what amalgam is. We're using clinical magnification as a standard, and even microscopes. Digital impressions to the point where we can do full arches and apply things like Invisalign to using digital imaging of a system rather than mixing goo, putting it in the patient's mouth. So in dentistry, we have ways to make changes, and the technology is changing around us. So it's changing in the world all around us, to say the least. And not just the technology, but in communications. If you look in our dental practices, you're going to start seeing more use of iPads. We're using wireless systems. And it's all that we're not just resting on what our past successes were, we're making improvements. And some of the improvements are in light years. Looking what's going on, pretty soon you're going to be able to sit, instead of passively watching a webinar like this, you're going to be involved with a group Skype type situation where you can observe the speaker talking, and they can watch your reaction and also stop the presentation and answer questions. Now, apply this to dentistry. This is of great interest for those of you who are interested in entering dental practice, because I do parallel entering dental practice like trying to jump on a raft in the whitewater. Well, if it looks like fun standing on the side, but once the raft's heading through the rapids, it's not a good time to get in there. So if you understand the stages of a practice, you might understand what you're walking into when you go into the dental office. In adolescence, we have an early stage practice where it's experimental, like in organizational growth. The dentist, if he's starting from scratch, is trying to find the right way, the right mix of services, the right type of patients to see, and they're experimenting with where they can go and find their niche in order to do the work. second phase is growth. They find a successful pattern, a recipe, and they grow. And often the growth is phenomenal. You get 15-20% of growth per year, and you're improving your technology, you're adding equipment, you may be adding staff, you're having fun, you're feeling success. And then that only lasts so long. It's no different than the other organizational growth patterns that we saw from George Land. You hit maturity, and so you've maxed out on your ability to grow. And if you don't make any changes, it tails off, just like in the other model for the cell phones, for instance. And then, of course, the real question is that once you go down into the decline, it's kind of hard to start up again because you've been coasting along. So imagine this. You're a dentist, okay? And you have this growth pattern. And if you understand organizational growth overall and how it applies to things in our everyday life, where on the growth pattern, if you're going to join a practice, what if you're going to join as an associate? Are you going to join someone when they're mature, post-mature? Are they expecting you to start that transitional growth, that second phase 1, to get the bump into practice? Are you jumping here in the middle of the growth so you're just part of the duplication, and they don't want your innovative input? They want you just to duplicate what they have already. So you have to understand where the practice is and then how you fit in to where the practice grows. So there's a lot of relevance to the both. But anyway, thank you very much for your attention, and good luck.